Hello, this is Meldita again here at my YouTube channel, Meldita's Info Corner. And this is my Facebook, johnrigacho@yahoo.ca. Okay, so last time I spoke about inferior STEMI, followed by anterior STEMI, but this time I'll be presenting to you lateral STEMI. I have a drawing here. So that is the right ventricle and the left ventricle. This side of the left ventricle is a septal area, and this side is the lateral area. So we have a lateral STEMI affecting the lateral side of the left ventricle. Okay, so we have a case here, 57-year-old male, okay, diagnosed with lateral STEMI, chief complaint of chest pain. He developed chest pain 7/10 while walking with his girlfriend and her dog in the park. So the chest pain radiated to his left arm and to his neck. So the girlfriend called 911 and the advanced life support crew arrived. So the cardiac monitor showed ST elevations. Okay, let's take a look at the 12-lead ECG here. So we have a lateral ST elevations, moderate, ST elevations B5 and V6. These are the lateral leads. We have a moderate ST elevations, B5 and V6. While inferior leads 2 and AVF, they have mild ST elevations. So are we saying that we have an inferolateral STEMI? So if we have an inferior STEMI, normally we have here reciprocal ST depressions B2, B3, and B4. Or we could have also ST depression on AVL. Okay, but we have a combo here. We have an inferior ST elevation and lateral ST elevations. Okay, so the ALS crew members, they loaded the patient with aspirin 320 milligrams orally, and they proceeded to a nearby hospital's cath lab. Other history of the patient showed here type 2 diabetes or NIDM, hypertension for high blood pressure, and we have also dyslipidemia or high bad cholesterol. Okay, so in the cath lab, while waiting for the cath lab table, in the whole bay, we have a repeat 12-lead ECG here. This is the same. It's the same as this, and this is the same. We still have the moderate ST elevations, B5 and V6. These are the lateral leads, and we still have these minimal ST elevations, inferior leads, 2, and AVF. Okay, so the patient went to the cath lab and an angiogram was done by our interventionalist cardiologist, and the patient sustained 3-vessel disease. Okay, so we have here a blocked right coronary artery, 90%. We have a blocked LAD, 70% mid, 80% distal. The branch of the LAD called the diagonal, 70% blockage. The circumflex or circ is clear, but the circ branch called obtuse marginal or OM is 100%. So the interventionalist cardiologist inserted a stent, okay, to this 100% blocked OM. Okay, the ejection fraction is 45 to 50%. That is borderline low. And the diastolic pressure is 15, which is borderline high. For CCU nurses, they will continue to monitor the patient and assess the patient, okay, to prevent further complications. Okay, so in CCU, 30 minutes to 1 hour, we do a protocol ECG here. And let's take a look. So going to the lateral leads, you see that the ST elevations and V6, so B5 ST elevation and V6 ST elevation, they're coming down. So that's good. And how about those inferior mild ST elevations? Let's take a look. Okay, so lead 2, okay, if you see lead 2 here, the ST segment is isoelectric. And if you look at the AVF, it's almost isoelectric. So that's also good. So that means our main problem is the lateral part of the left ventricle. Okay, then an hour and a half passed, another 12-lead ECG, and let's take a look. So the ST elevations on B5 and V6, they continue to go down, and that is good news. Okay, so we have a lateral STEMI with a blocked OM, and a stent is inserted. So what did we do here? So we open up the blocked artery and we revive the flow to the lateral side of the left ventricle. Okay, so the revascularization is a success. So we open up the blocked coronary branch here. The blocked OM is opened up with a stent, and we revive the flow to the lateral side of the left ventricle. So that's good. So we did not sustain any Q waves, which are sign of infarct, and that's good. And what did we do here? With the success of this stent insertion, We are making the evolution of the Stemi shorter, the duration, and we are preventing complication. Okay. So, these two blockages is a concern. We're not out of the woods yet here. So, if you look, we deal with the main culprit, which is the OM, 100% block. And we succeeded that in opening up and reviving the flow to the lateral side of the left ventricle. However, we still have some blockages in here, the two vessels. So the interventionalist cardiologist will refer the patient to a cardiac surgeon. So the cardiac surgeon will review the angiogram picture, will talk to the patient, and will discuss everything to the patient in terms of surgery. And if the option is CABG, that is coronary aortic bypass graft, he will discuss further with the patient. If the cardiac surgeon says that the patient's option best will be PCI, then the doctor, the cardiac surgeon, will speak with our cardiologist about PCI and the patient not needing CABG anymore. So if the option is CABG, the cardiac surgeon will discuss more the benefits of this to the patient and why. And if the option is PCI, then the cardiologist will be the one to speak with the patient and discuss more about the benefits of PCI. Okay, so that's about it. So the English version of the lateral Stemi is finished, and I will follow this with the Tagalog version. And again, thank you so much.